Thank you, Senator Johanns, and you have a unique perspective yourself as a former cabinet member, governor, and now senator. But all three of us here today, including the former governor of North Dakota, have wrestled with this business of the rising costs of Medicaid, paid for partly by the states, according to rules set in Washington. And how do we deal with public education, especially higher education? I remember during the debate last year, I suggested to our colleagues on the other side of the aisle who were supporting the health care law, which I thought was an historic mistake because it expanded a health care delivery system that we already know is too expensive instead of taking steps to reduce it. I suggested to them that they go home and run for governor. They ought to be sentenced to go home and run for governor if they vote for it and see whether they can implement it over an 8-year period of time. And here's why the senator from Nebraska is suggesting this, and let me try to be very specific, and that is the effect of the health care law on higher education in the states. Now, this isn't all President Obama's problem. 30 years ago, when I was a young governor, I was still struggling with saying, you get down to the end of the budget process and you have money either to put in higher education or to Medicaid, and the rules from Washington say it has to go to Medicaid. I remember going to see President Reagan and saying, why don't we just swap it, Mr. President? You take all of Medicaid, let we states take elementary and secondary education. I wish we had done that, but we didn't do it. And gradually, the increasing Washington-directed costs have distorted state budgets until, as the senator from Nebraska said, 24% of the state budgets go for this Medicaid. Now we're in a process where, because of the health care law, we're going to have millions of Americans on a Medicaid. Employers, and we don't really know the number, but we know it's going to happen. We know it's going to happen. Employers are going to decide, I'd rather pay my $2,000 penalty and let my employee go into the exchange, or if they're lower income, into Medicaid. And then costs to states are going to go up. The senator from Nebraska talked about what the current governor of Nebraska said. Our former governor, Governor Bredesen, a Democratic governor, estimated that between 2014 and 2019, it would be a $1.1 billion in new costs for the state of Tennessee from the Medicaid expansion. What most people don't realize is the effect this has on higher education and student tuition. I hear a lot of talk about, well, let's see if we can lower student tuition. One way we could lower it is not take money from student loans and spend it to pay for the health care bill. Most people aren't aware that we spent $8.7 billion of so-called profits that the government makes when it borrows money at 2.8% and loans it to students at 6.8%. The government took some of that money and spent it to pay for the health care bill. And if it didn't do that, it could lower the interest rates on student loans, according to the Congressional Budget Office, to 5.3% and save $2,200 per student over 10 years on a basis. So the health care law is costing students who borrow money more on their loans. And in addition, and I'll close with this example, it's raising college tuition. You'd say, well, how could the health care law cause tuition to go up in California or Tennessee? Well, if in Tennessee, as last year, increase for Medicaid went up 15%, that's how much more state tax dollars it had to go up, and spending for the University of Tennessee and community colleges went down 15%, then the result of that was tuition went up in our state by about 8%. And that was true all across our country. So the effect, and I'll come back to this later if we have more time, is that the health care law mandates that the state spend more money on Medicaid, and as a result, the state it cuts the money it's spending for the University of Tennessee or Nebraska or North Dakota. In order to keep the quality of education up, tuition goes up, and so students are paying more for tuition, and they're paying more for interest rates on their student loans directly because of the health care law. President Obama shouldn't be blamed for the last 30 years of rising costs of Medicaid. but he should be held responsible, and this health care law should be held responsible for making it worse. I listened with interest to the former governor of North Dakota and former governor of Nebraska. Let me give you a specific example. I met, in response to your question, I met after the passage of the health care law with a number of representatives from chain restaurants. Chain restaurants, and we all, the kind we go out to dinner at a modest cost, are among the largest employers in America. They employ largely low income and young people who are the waiters and the waitresses that you see when you're going to Ruby Tuesdays or O'Charlie's or one of these places is someone with a part-time job or someone working their way up. Many of these companies offer some health insurance to their employees. At one of the companies, Ruby Tuesdays, which is headquartered in Tennessee, the chief executive officer told me that the cost of the health care law to his company would exactly equal the profit of the company that year. Now, this is a company of several $1 billion in revenues. One of the companies that's even more successful than Ruby Tuesdays in terms of profit over the last few years and is larger told me that their goal was to have 90 employees per store, but after the health care law, they'd have 70 employees per store in order to comply with the cost of the health care law. Now, this not only raises the cost of business, but it reduces employment in the United States. And unfortunately, Senator Johanns, I'm afraid what we may find is these restaurant companies, after 2014, we're about 1 year away from a ticking time bomb for state budgets and for businesses, but also for people with employer health insurance. I'm afraid that these companies are going to look at the penalty and say, I'd rather pay $2,000 per employee and let them find their way into one of these state exchanges or into the Medicaid program. And millions of Americans, because of the health care law, are going to lose their employer-sponsored insurance, and millions of Americans are not going to have as many jobs because of the costs imposed on businesses like these restaurants.